if you follow good hygiene protocols, that contact lens wear is relatively low risk. There is still a small risk, but it's relatively low on the grand scheme of things. There are so many different brands, so finding and different lenses we can try. So finding something that enables you to see clearly is out there. In our practice, if someone's unsure if they can actually do that, if we assess you and say, look, you qualify for contact lenses in terms of physiologically your prescription, what you want to use them for, but they're a little unsure about whether they can actually wear them, then we do as part of our trialing process. So there's a way of kind of dipping your toe in the water without fully committing to it. Because, particularly with disposable lenses, we're not having to sort of purchase product or anything like that. In the initial stages, your only fees are the consultation, sort of chair time fees, to at least try it and give it a go and see if you're a good candidate, and you might be pleasantly surprised at what the experience is like.
Active Australians, whether they are serious athletes or just trying to keep up with the kids on the weekend, often hit a wall when it comes to vision correction and sport. Do they put up with glasses fogging up and slipping around, or is there a better option? Today I'm joined again by Paul Graham, Principal Optometrist at Harmony Vision Care on the Gold Coast, to answer some of the most common questions about contact lenses and physical activity, from the real advantages that lenses can offer to how to choose the right type and how to stay safe, and what parents of young athletes should understand before making the switch. For those who are new to this channel, my name is Paul Salloway. I'm the owner of Optics Digital. We're an agency that helps eye care professionals to connect with their community through educational videos like this one. So Paul, great to have you back.
Yeah, great to be back. Thanks, Paul.
So Paul, a lot of people who wear glasses just accept that sport is going to be a bit awkward. Things slip and vision's compromised, or they just go without vision correction altogether and hope for the best. But it doesn't have to be that way, does it?
Not at all. Not at all. Contact lenses are a fantastic way in their various forms for improving your just pleasure of the sport, let alone, increasing your ability, and particularly if you're starting to play more and more serious sport.
Remember, like in my early 20s, by that stage, I realized I was short-sighted, and I was wearing glasses, and I think I was also getting into indoor cricket at the time, and I think I was wearing glasses with one of those like nylon straps at the back, and I just wish now I'd got into contact lenses a lot sooner. So maybe just to start off with, what are some of the ways that contact lenses actually give you some advantage over glasses when you're playing sports or being active?
Yeah, well, obviously you've already sort of mentioned, the whole slipping. You've got fogging. The problem with slipping, obviously, is just the distraction and the annoyance of having to adjust your glasses, but it also changes where the optics are relative to your visual system. So it can create blur, it can create sort of prismatic effects, so you lose judgment of where things are at. So, you've got that part of it. If you're in a situation where you want to wear your choice of particularly wraparound sunglasses, then being able to wear contact lenses underneath really opens up the choice of sunglasses that you've got available. And the best thing about a contact lens from a vision point of view is that you're always looking through the best optics. So because the lens moves with your eye, you're always looking through the dead center of the lens, and you're not being distracted by any sort of peripheral issues with the frame kind of getting in the way of your vision. And if we broadly talk about prescriptions being long-sightedness, short-sightedness, or hyperopia, myopia, and astigmatism, they all bring some different sort of challenges with glasses in sport. So, things like if you have to wear glasses for hyperopia, they're a plus lens. You actually lose a bit of your visual field. So if we kind of think of the extreme example of a plus lens being a set of binoculars, we know it makes a small patch of the world out there very big in your vision, but you'll lose a good deal of peripheral vision. So that happens on a mind level. And if you're short-sighted and wearing glasses, you actually potentially get a bit of doubling. Things moving outside the field of the glasses, then moving into the glasses, stops you being able to judge where things are at. And then the final part is, if you're having to turn your head, and I'm an archer, so this is a common problem with people wearing glasses. If you're having to turn your head, you're looking through not a very good part of the lens. So often there's aberrations and prismatic effects. And perhaps if you are an archer, you can get used to that after a while. But if you're shooting in different sort of positions, then it creates issues. And then so obviously someone who's in a more dynamic sport is really going to start to struggle with this changing, prism dynamic as they move their head around.
Yeah, so I can easily understand, like if you're involved in any sort of sport where there's ball tracking involved. You really want to maximize that peripheral vision, don't you?
Yeah, and and then you've got peripheral vision, and you've got fogging getting in the way, you've got sweat kind of getting in the way, the glasses getting dirty. I mean, all of that reduces how well you potentially could play. And if you're really playing at a very competitive level, every tenth of whatever counts. The difference between you and the next person might be, you both might be great, but that extra little tenth might give you the edge.
Yeah, and I think as we've talked about in the past too, like when it comes to like tracking things, often you have to keep your head still. So it's, that's where I think peripheral vision can really become much more of an issue. So you mentioned about wraparound glasses, and maybe that's something that a lot of people haven't considered, is that if you do wear glasses, there are some limitations into how you can get those prescriptions built into wraparounds, aren't there?
Yeah, and look, there's been some great advances in spectacle lens technology that tries to counteract the impact of wrapping a lens. And so when you wrap a lens, then you potentially get additional aberrations and different effects from having such a curved surface. And so the things that you can program into a spectacle lens to try and combat that, make the lenses thicker. There's often an upper limit on what prescription you can do, and that limit sometimes gets hit pretty quickly. And then you still have a limitation on the type of frame that you can put that in.
So are there any situations where you'd still recommend glasses instead of contact lenses?
Look, I guess there's a contentious one around water sport. The safest thing to do is wear prescription goggles as opposed to wearing contact lenses in the surf. You could potentially consider Ortho-K as your contact lens type there, and we can chat about that in a moment when we discuss the different types. Because that basically removes the lens being on your eye while you're in the water. But we can talk through the water aspect when it comes to sort of hygiene. There are some occasions where people with very high astigmatisms might find glasses just that little bit more stable than a contact lens. But there are so many different lenses available in terms of how we can custom made. If you're really serious about your sport and you want very, very stable vision, and you've got either irregular astigmatism or higher degrees of astigmatism, we can even go to something like a large RGP or a meniscaleral style lens to really help with that sort of correction. So there are things possible. So there aren't too many instances where I would say glasses are definitely the way to go. If it's a safety situation, then you still might have the advantage of having the contact lens on, but safety glasses over the top. I still think that's going to be a better visual outcome than prescription safety glasses in that sort of sporting sort of situation. If you're playing squash, squash you don't hear talked about much anymore, but if you're playing that, you still need to be wearing safety glasses. And so I still think some contact lenses with the safety glasses would be better than a prescription in that situation.
I've heard that the options on the market now for multifocal soft contact lenses for people with astigmatism are still a bit limited, but there's more coming on the market. Is that right? Like toric multifocal soft contacts.
Yeah, look, I wear a multifocal contact lens myself. I don't have much in the way of astigmatism, but the brand that I wear does help correct by accident a little bit of astigmatism. But we do have what we call tailor-made monthly lenses. So we've got a couple of different brands that we can use. So there are a couple of different options out there. I do believe that they might be bringing out a one-day toric multifocal in the near future. Now, near future on these things, I don't know if that means 1 year, 2 years, or 5 years, but the way research goes, near future can be like a 5-year kind of plan. But for the companies to be talking about it, it means it's probably not all that far away.
All right. So Paul, when you're assessing an active person or an athlete, what are the main things that you look at before deciding whether contact lenses are a good option for them?
Yeah, and look, I think it goes back to that question of when would you recommend glasses. If I find someone has certain types of, strong allergies, problems with dry eye, those sorts of things, any sort of eyelid anomalies that may not work well with contact lenses, then I want to have a careful look at that. Some of those things we can actually deal with through drops or dry eye treatments. So it may not be a kind of a line in the sand for them, but certainly something we want to consider is, does the person's sort of physiology stack up to allowing contact lens wear even on a part-time basis being comfortable and possible for them. We would do measurements on eye shape. So we use what we call a corneal topographer, which gives you kind of a very detailed map of the curvature across the whole cornea. So we can kind of get a sense of, the size of the eye, the shape of the eye, what sort of lenses are likely to fit. And if we're doing more complex contact lens fitting, we really, really use a lot of that information to help us design the initial lenses. And it's a critical part of fitting something like ortho-K. So topography is generally a good part of that. Obviously, we're going to want to know what their prescription is. And part of it also is, a detailed discussion around what are you going to use these for? Do you only need distance vision? Do you need to be able to read them at the same time? Are you going to be using them just for sport, or are there other activities or things in your life where you're going to be using them? So that'll start to kind of work out which way we might head in the balance of things.
And for people who do have really complex eye conditions, whether that be keratoconus or severe dry eye, there are other specialist contact lenses, aren't there, like scleral lenses, which have come a long way. Can you
absolutely
and explain what those are?
Yeah, so a scleral lens is a type of hard lens. So hard lenses have been around for literally a century, and they, in their traditional smaller designs, they have a little bit more eyelid awareness, so it requires a bit more dedication to getting used to them. But because you're providing a very good, clean surface that keeps its shape while you're wearing it, that's a very good optical surface. So if your cornea is more oddly shaped, the contact lens in front with the tears in between creates this nice round optical surface that improves clarity. Now, if we do it with a scleral lens, it's almost as big, or if not bigger, than a soft lens. They become very, very stable. And the comfort is actually fairly close to a soft lens. Once you start wearing them, it's not the same as the old smaller RGPs, which have a place, but do require a bit more commitment getting used to. So the scleral wraps right over the cornea and creates a brand new optical surface to look through. So great for irregularities. You're trapping a wet surface. So for some people with dry eye, it can add that sort of barrier for using it for short periods, for sure.
Well, so you mentioned some different types of contact lenses. So maybe this is a good segue to my next question, which is how do you match the right contact lens to someone's sport or their training environment? Like what sort of questions do you ask when you go through that fitting process and talk about someone's lifestyle needs?
Yeah, look, generally we're going to lean towards a soft lens of some sort most of the time. There's sort of lots of different ones available, covering a wide range of prescriptions in terms of whether you just need a spherical lens just to correct some hyperopia or myopia, whether you need a toric lens to correct astigmatism. If someone's in really, really dusty environments, we might lean into more the sort of mini-scleral, but usually a soft lens is well tolerated in those sorts of situations, particularly if you're wearing sunglasses or some other sort of protection over the top. So generally speaking, we lean towards single-use lenses a lot of the time, regardless of whether you're a full-time wearer or a part-time wearer, because they have the convenience of you getting a fresh lens every day. So it's the most comfortable way of wearing the lens. They have the least complications. Occasionally you might hit a limit somewhere where the prescription is just not available in a one-day lens, so we might move to the other forms of frequent replacement, which I'll discuss in a second. The advantage of a one-day for part-time wear is probably even further, because you don't have to keep your lens that you've just worn in solution. You don't have to clean it. You don't have to worry about how many times have I worn it, how long has it been since I wore that lens. So if you're considering wearing contact lenses just for sport and you're not going to be wearing them during the week, then a one-day lens is ideal, assuming that it's going to sort of perform well. So if you're a full-time wearer and maybe the cost of 1 days is you're looking for something a bit more economical, or like I said, we're heading down the path of having a lens that we're needing more parameters. We need a different prescription that a 1 day just can't handle. Then we're moving into, say, maybe a fortnightly lens, so what we call a 2-weekly lens, or more commonly a monthly lens. So what we mean by those is that if you were wearing them each day, you take them out each night, clean them, put them in a cleaning solution, what we call a multi-purpose solution. And at the end of a fortnight for a 2-weekly lens, or at the end of a month for a monthly lens, you're throwing them out, and then the next day you're opening up a brand new set of lenses.
You mentioned that there are different types of one-day lenses. I've heard that I think there's one brand, might be Johnson & Johnson. They've got new contact lenses with well, new type of contact lenses with technology built in that makes them much more comfortable for people who suffer from dry eye. So I think like the whole technology behind contact lenses has really improved a lot in the last decade, hasn't it?
Yeah, and you'll find that across all the manufacturers. So, Alcon, Cooper Vision, Johnson and Johnson, probably the main players, Bosch and Lom in there. So they're all creating ways of making the lenses more comfortable. I wear a lens called the Natural View, and they made a change to even just the edge profile and how they coat the lens. It made a huge difference in the comfort of the lenses. So all the manufacturers are finding ways of making contact lens wear more comfortable and achievable for people.
All right. So what about swimming then? Swimming and other water activities. So why is it why is it something where we have to consider the risks?
Yeah, and when I'm talking to patients about contact lens wear, your top two sources of infections are water, and the second one is cases. So, if we just eliminate the case story out of the way at the moment, if you're wearing a lens that needs to be cleaned, then we recommend that you replace the case every time you open a new bottle of multi-purpose solution, because that helps control the number two source of eye infections. So the number one is water. In particular, 𝗵𝗿𝗺𝗃𝗃𝗃𝗃. And if you have someone swim in water with their contact lenses and take the contact lenses out and you measure them, then you find bacteria like 𝗵𝗿𝗃𝗃𝗃 stuck to the lens. And so that's where the concern is. The increased risk of getting an eye infection is the contact lens actually holds on to the bacteria against the eye, so it creates more opportunity for an infection to occur. Now, infections are quite rare, but if you get one from 𝗵𝗿𝗃𝗃𝗃, it can be quite nasty. So this is where the concern is. So if you, the first step is, do you really need to be wearing contact lenses while you're in that water activity, particularly if there are, things like prescription goggles being available and those sorts of things. And then we step it down from there. So this is what I want to be sort of careful, is that the advice is don't wear them while you're doing water activities. But if you absolutely must, then wearing goggles over the top adds a reasonable degree of protection. If you happen to get exposed to water, then removing them after you've done the water activity. Don't continue to wear them for hours afterwards. Or if there are a lens that you're frequently replacing, make sure you do a thorough clean with a good rubbing step and let them soak. A lot of my one-day users, if they wear them in a water situation, will just throw them out. If you're wearing a spherical one-day contact lens, it's sort of about half a cup of coffee in terms of cost for a pair of lenses. So, if you like your water activity and you're going to be wearing contact lenses, then the next best thing to not wearing them at all is throwing them out as soon as you've done.
And I guess Ortho-K is another really good option, isn't it, for people who are in and out of the water a lot?
Absolutely. And, as a caveat to anyone who spends time in the water, whether you're wearing contact lenses or not, I mean, it's not a bad idea to put some lubricant in after you get out of the water, just to make sure you flushed out any bacteria in there. The advantage of Ortho-K is that it's a contact lens that you only wear while you sleep. So it puts some emphasis on some hygiene in that wearing sort of situation, because you are sleeping in them. So you need to be careful around case hygiene, not introducing water, washing your hands. But for water activities, with an Ortho-K lens, you're basically putting the lens on the eye, going to sleep. It's using tear forces to gently reshape the cornea into a shape that allows you to see when you take the lens off, and you can see all day. So then you can do your water activities and not be worried about having something on the eye that's going to attract and have bacteria stick to it.
Okay, well, if you're watching this on YouTube and you're getting value from the discussion so far, could you do us a favor and please hit the like button, because it really helps us out with the algorithm and it increases the chances that other people might also benefit from the conversation. Okay, Paul, so we hear a lot of worries about contact lenses falling out or getting stuck behind the eyeball. That's a kind of another common myth. So what are some of the myths that you would like to clear up for people who also play sport?
Yeah, look, the eyelids actually form a pocket with the front of the eye, the conjunctiva. So there's actually not a lot of room there. So the contact lens may fold and kind of sit in the pocket on or above the eye. So it's rare for a contact lens to truly get stuck up there. Quite often, if I have a patient who's come in and said, I can't get my contact lens out, quite often it's no longer there. And when we look in the pockets and or underneath the eyelid and then down the bottom, well and truly the lens is not there. So you hear of those internet stories of finding 17 contact lenses up under someone else's eyelid, and I don't know about the credibility of them, because there's not a lot of room there for that many contact lenses, that some of them would eventually find their way out. And if we think about it, wouldn't be a very good design to have access to the brain through the eyeball that quickly. All sorts of stuff would get back in there. So so lots of protection. You really, yes, you can rub and fold the lens up there, but it's usually easily retrieved. As far as lenses falling out, look, a lot of that came from the very early days. We're talking 1950s, 1960s, where people wore very, very small, basically polycarbonate lenses, just about, very, very tiny 8mm lenses, and obviously manufacturing tolerances in those days are nothing like what we've got now. And so it was very easy for the lens to sort of fall out or get blinked out. So there's a bit of that's carried on over the eons. I think a lot of the time lenses come out when you rub your eyes. So one of our bits of advice is, well, if you're wearing contact lenses, don't rub your eyes. We're not a fan of eye rubbing, irrespective of whether you're a contact lens wearer or not anyway. It's not a good thing to be doing. If you're needing to rub your eyes, you need to be asking why, and dealing with whatever sort of irritation or discomfort's causing it. So where you might inadvertently blink a lens out, again, probably one of those more extreme sort of situations where your eye is particularly watery or particularly dry. And so the lens is not performing or behaving well. So again, if they feel particularly watery or feel particularly dry, you really want to be careful about not eye rubbing. So I think that's a critical piece, that contact lenses, if fit well, and that's the thing that we need to make sure that the lens is fitting well. So a loose fitting lens is more likely to move around to a point where you might more easily accidentally rub it out. But the big one is just avoid eye rubbing, and I think you get past most of those kind of issues.
So those stories about lenses falling out, from decades past, I'm assuming that they must have been like RGP hard contact lenses, because soft contact lenses are so adhesive. I just don't see how that would happen with a soft contact.
Yeah, so and if we look at even a good fitting hard lens has a much greater volume of tears underneath, so they're designed to kind of move around, and that's what makes them a very healthy lens. Actually, it's just that people have trouble getting used to the feeling of this lens moving around a bit, whereas a soft lens drapes or wraps, and so you've got a much finer layer of tear films, and that's what causes it to kind of cling.
I did have a friend who was into contact sports, and he wore soft contact lenses. But one of the issues he had was that sometimes when the opponent's glove would hit his eye, his contact would stick to their glove.
Yeah, right.
So I don't know what the solution would be for him. Maybe Ortho-K, he'd be a good candidate for that, perhaps.
Yeah, no. If you're talking sort of the contact sports like that, that raises more concerns for me for a whole bunch of other reasons, because of we deal with concussions and whatnot in our practice, and seeing our odd blowout fracture. So you start to get into murky waters about the whole, is that a good sport from a vision point of view anyway? But yeah, look, your fingers in eyes playing a tackle sport, those sorts of things, they're a risk. I wouldn't promote a contact lens being a safety device, but you would expect that if they're rubbing the lens out, then they haven't yet got to your eye. So there may be a minor degree of protection, but like I said, I wouldn't be sort of saying, hey, let's go and wear contact lenses to protect our eyes. But, I think it's just one of those things that you take if you're wearing one-day lenses, take some spare lenses, make sure you're able to keep your hands clean and replace the lens if there's no other injury.
Okay, well, that's a good follow-on for next question, which is, what does good lens hygiene actually look like in the everyday life of a busy person?
Yeah, so making sure the lens is sterile. So, I probably should back that up and say, well, hand hygiene. So we learnt during COVID how to wash our hands properly. Well, that's what we should be doing. So washing your hands with soap thoroughly, paying attention to fingertips, and a good 20 to 30 second wash, and then drying them. Making sure the outside of the blister pack is clean and not got stuff all over it. Making sure that the actual contact lens is still in date. So they often have an expiry date. Now, most of the time, expiry dates nowadays are several years down the track. So if you're a part-time wearer and you're buying, maybe 3 months supply and it's lasting you a year, most of the time the expiry date's going to be fine. But it's a good idea to sort of start checking that. And then, so once you pop the lens in, you've got clean hands while you're doing that. Same in reverse, that when you want to remove the lens, you're washing your hands thoroughly again. and then removing the lens and disposing of it. If it's a single-use lens, if it's a frequent replacement, then you're making sure that you're using the proper contact lens cleaning products that your optometrist has recommended to you for your particular style of lens, and following things like make sure you do the rubbing step. It's the one step that everyone gets lazy with, but it actually does 90% of your cleaning. And I think we've talked about clean cases, so making sure you replace the case every time you get a new bottle of soaking solution. Don't top up. Make sure you're throwing out the used solution every time you pop your contact lens wear, and letting the case dry. So they're kind of the critical ones. And again, like we said, if you can avoid, you need to avoid getting water on the lens, and so sort of clean cases. Don't be afraid to lubricate your eyes while you're wearing the lens. So contact lens comfort's very important. So if you've got constant irritation, constant awareness of the contact lens, and lubrication doesn't help, then we have a saying, if in doubt, take them out. So don't persist with a lens that's uncomfortable, because you might potentially either missing a very early infection or providing a pathway to make infection a higher risk kind of sort of situation. And then the final caveat is, if you have a sore red eye that persists after wearing contact lenses, and again, thankfully this is very rare, but the important thing is you go and get it seen to. Don't wait a couple of days. It's a same day kind of thing. So see your optometrist if you're near a public hospital and you've got a really sore red eye. Then I advise just go to the local public hospital. But I want people to know that's a rare situation, but it's good to know what to do if you're one of the one in several thousand people it might happen to.
Normal disclaimers about health advice supply, right?
Yeah, and look, and absolutely, this is all general advice. There's nothing like you really need to have everything set up for your specific situation and needs.
And you mentioned about drops, and maybe it's worth mentioning that there are specific eye drops for contact lenses. You can't just kind of take any old eye drops from the chemist, right?
Yeah, well, you need to be careful with your selection of drops in general, regardless of whether it's contact lenses or no contact lens wear. If you've got something that's pretty much a tear supplement or a lubricant, most of those are fine. Generally, they'll say on the packaging whether they're safe for contact lens use. I would certainly avoid using something that is a medicated eye drop while you're wearing the lens. So any allergy eye drops, any eye whitening eye drops, I'm not a fan of those in general at all anyway. And trying to avoid something that's got preservative in it. So leaning towards something that's preservative free is ideal. And there's different packaging you can get now. You can get ones that are in a bottle, but they have special kind of lids and sort of valves in them to have the bottle be open for several months despite being preservative free. But if in doubt, the individual doses are always a good one for preservative free.
Okay, so last questions. So for parents of teens who want contact lenses for school sport, what do you want them to know about safety, responsibility, and how you support those children to wear their contact lenses comfortably?
Look, obviously it's going to need some parental supervision in that sort of insertion, removal and cleaning process until you're confident that your child is following those practices. The argument around, is contact lens wear more or less safe in that age group. The research seems to indicate that children and teens are at no higher risk than adults when it comes to sort of eye infection. In fact, I've seen a study that suggested maybe the 19 to 25-year-olds are the highest risk category. The new adults, newly minted bulletproof adults, perhaps making some lifestyle choices that don't bode well for contact lens risk. So, certainly you might argue that at one level, kids and teens well supervised by parents make safer contact lens wearers than young adults.
So if they're in the routine of brushing their teeth at night, there's no reason to think they can't get into similar good routines with contact lens wear, right?
Absolutely, yeah.
So how do you decide if a teen's ready to handle lenses themselves? Like what would you say is a good indicator there?
Look, if they're motivated, the teen being motivated themselves is an important factor. Sometimes we might go through a process of a little bit of a trial to see if they can get to the point of having someone like myself put a lens on their eye, and just I often say to patients after inserted the first lens, that you've just done the most difficult thing of contact lens wear, and that's getting the first one on. And then when I put the second one on, it's like, well, you've now done the second most difficult thing of contact lens wear, and it's getting the other lens on. And so you can get a sense of their readiness in that kind of situation. And so I like to say to parents, there are three people that need to be ready for contact lens wear. I need to be ready, you need to be ready, and your child needs to be ready for it as well. So, motivation certainly plays a factor. And so when you start getting to 11, 12, 13 years old, the motivation increases because they start to think about their own reasons for wanting to wear contact lenses versus glasses. And then it's a matter of going through a process of just having to watch what their handling skills are like, and making some decisions around, can they put the lens on themselves, can they take it off themselves, what's their sort of awareness like. Are they doing anything that's kind of risky? I mean, eyes are pretty tough, but there are certain things that we like to sort of see to make sure that someone's not going to hurt themselves. And again, the hurting themselves is not necessarily a risk of serious injury. It's more putting them off contact lens wear because of some early kind of teething issues that just require a bit of time and patience for.
What's the youngest patient you've had that's been able to get to more or less unsupervised contact lens wear?
Quite a lot in the kind of tweens and teens, but younger than that, I think of one I've seen recently, I think about 10 years old. I'm sure I've probably had an 8-year-old, but when you start getting down to that age, there's a lot more sort of parental assistance. Yeah.
All right. Well, for someone who's been on the fence about contact lenses and sport, maybe they've always just managed with glasses or gone without altogether, what would you want them to know before writing off the idea of contact lenses?
So that if you follow good hygiene protocols, that contact lens wear is relatively low risk. There is still a small risk, but it's relatively low on the grand scheme of things. There are so many different brands, so finding and different lenses we can try. So finding something that enables you to see clearly is out there. In our practice, if someone's unsure if they can actually do that, if we assess you and say, look, you qualify for contact lenses in terms of physiologically your prescription, what you want to use them for, but they're a little unsure about whether they can actually wear them, then we do, that's part of our trialing process. So there's a way of kind of dipping your toe in the water without fully committing to it, because particularly with disposable lenses, we're not having to sort of purchase product or anything like that in the initial stages. Your only fees are the consultation sort of chair time fees, to at least try it and give it a go and see if you're a good candidate, and you might be pleasantly surprised at what the experience is like.
All right, Paul. Well, thanks very much. So for this information, I think in a very sort of active country like Australia, where many people are into sports, I think a lot of people will find this very helpful. So if someone's on the Gold Coast and they're thinking about contact lenses for sport, or wants to find out if they're a good candidate, how can they get in touch with you at Harmony Vision Care?
So 𝗵𝗿𝗺𝗀𝗃𝗏.com.au. You can call the practice on 0755205900, and we have a Facebook page as well. But the website has a wealth of information, but you can also book through the website as well, or contact us if you've got some other questions.
And if you've found this conversation helpful, again, please like, subscribe, and share with someone else who might benefit. Okay, well, thanks for watching. Thanks, Paul, and we'll see you all next time.
Thanks again.